everyone, we are at THIT 2024. Again, as I said, this is the inaugural session of THIT after COVID-19 pandemic. We are joined by Ms. Sangita Reddy, Joint MD of Apollo Hospital. Ma'am, what do you expect of THIT and what can we as audience also expect from it?
So clearly, transforming healthcare with information technology is an idea whose time has come. When we started this conference about 14 years ago, we used to have 150, 200 dedicated people. When we did telemedicine 24 years ago in the year 2000, people were really wondering what this is. But now we are seeing that all these are mainstream technologies and there is no concept like telemedicine. The tele is already embedded into medicine and it's seamlessly moving from physical to digital healthcare. And so having worked on in this space for the last 24 years, I'm extremely gratified. And today you must be seeing that between patient safety and transforming healthcare with IT, we have close to 4,000 delegates at this conference. It is a tremendous validation of the fact that these are two very important subjects, of the quality of the speakers that we have, and of the fact that over the last many years, we at Apollo have tried to share whatever we know. And so people come to hear some of the latest updates, come here to try and understand what more can we do in this space so that we can be prepared for the future. And as is said, the future is faster than you think.
Ma'am, one more question. THIT refers to transforming healthcare with IT. Patient data digitalization is going to be the next big thing. Where do you think it will go in terms of industry estimates?
So in terms of size, people say that the healthcare IT space or digital health is over $350 billion in terms of global size. For me, it's not just about the number. For me, it's the fact that when you have a digitalized record, you enable continuum of care. You don't ask the patient for the same history time and time again. When you have structured data, you're able to do analytics. You're able to put this into AI models and your quality keeps improving. When you have these pathways or generative AI algorithms embedded into your systems, you can enable nurses to do a higher level of care. You can make sure that doctors do a higher level of care and the mistakes or the problems of patient safety can be minimized because of the right knowledge, the right diagnosis, and at the right time. So for me, digital healthcare is an imperative to reduce costs, increase access, and greatly improve quality.
With patient data digitalization, ma'am, one more important aspect that comes into play is the safety of their data. In terms of we have DPDP Act for data in healthcare. Do you think that Act is enough to safeguard or take action on such breaches?
So many of my team members were part of the consultative committee before the data protection bill came out. I believe that the laws are quite stringent. I believe the punitive measures are even more stringent and therefore people will take this seriously. We ourselves are looking at enhancing the standard, training people on the ground level about the ramifications of data privacy. There's a lot to be done, but I think the framework is in place and the industry will evolve.
Ma'am, I heard you speak at length about artificial intelligence in healthcare and how Apollo is pioneering into different technologies with respect to artificial intelligence. Could you tell us about your collaboration with Google and Microsoft and how you are going to take it forward?
So AI is a deeply complex technical subject and healthcare is a deeply complex technical subject. So rather than, trying to master, we have data scientists, we have engineers, we're building our own algorithms. But the ability to use this and to bring it together, so bring the power of the computational, of the data scientists, of large organizations to apply them into our deep domain knowledge of healthcare will generate a solution faster. And therefore, we're seeking tie-ups, we're doing validations with institutions like MIT and the Karolinska Institute. We're partnering with other hospital groups to bring in more collaborative data consortiums. We believe that confidential computing is critical. And I do want to state that I believe that AI is an assist tool for healthcare workers. It is there to help us practice better medicine. It is not here to replace healthcare workers.
Right. Ma'am, we are standing near this ambulance, and it would be wrong of me to not ask about this 5G connected ambulance. What is this concept?
So when you have connectivity all over, it's important for you to use that connectivity to ensure that every minute you are bringing the best possible care to a patient. So almost 19 years ago, Apollo started this wireless ambulances, which helped us take an ambulance quickly to a patient's home or to bring them. Then we trained our paramedics so that care began in the ambulance itself. We had some cardiac ambulances, so there was a doctor sitting in. But to really create scale, now what do? You connect the monitor, the DFib, and telemedicine. You use your phone, and then you start your treatment the minute you're in the ambulance because you're connected to the emergency room. And when the patient reaches the emergency room, the doctor's already begun the treatment, and all the other relevant doctors are ready and waiting for him. So it reduces response time, it enhances the quality of care you're giving, and ultimately and most importantly, this is about saving lives.
Ma'am, one last question. We are talking about healthcare from the perspective of third person. They see healthcare as a very complex structure, but we inside know that health tech is now coming up. In terms of, you see, there was a wave of tech companies in 2000, then there was a fintech wave. Do you think that health tech is going to be the next wave?
So I don't think there's any doubt that health tech is going to be the next large wave because this is, the era or the decade of biosciences. And I believe that the biology or the gene that we have deciphered is going to give us new insights. The bytes or the computational capacity with Moore's law, where we're using more and more compute, whether it's in our MRIs or our CTs or even in the way we're analyzing AI algorithms. And finally, with bandwidth, we're connecting all this and adding devices to it. So this combination is going to create a whole new wave of connected, digitally enabled, generative AI enhanced healthcare interventions. And then the whole era of discovery. So all the omics, genomics, etc. will evolve. But then you'll also have accelerated discovery. So if you got a biomarker because you got the data right, you quickly found a biomarker, you will be doing diagnosis for early cancer. This will herald a stage where the treatment will move from treating advanced disease to proactively preventing or finding disease early through screening. The site of care will move from the hospital to the clinic to the home to a 24/7 ubiquitous access to care enabled by your mobile phone or your watch or your device. All these are going to be, and the doctor is no longer alone. He will be surrounded by specialists who are also participating in the care of the patient. All these changes are happening live in front of us right now. And it's for us to adopt these changes for the benefit of humanity.
Thank you. Thank you so much.
Thank you. Bye-bye. See you.